Testing, testing.
Hello, hello. Can you hear me?
I can hear you. Can you hear me?
I can hear you.
Cool. Let's go.
What a week it's been.
Truly. I'm Alex.
And I'm Emily, and welcome to What a Week.
You want it, we got it. We're bringing you news by zillennials for zillennials.
Let's dive right in.
Okay, so we're very excited about this episode. Let me just say that. For those who don't know, April 10th is National Youth HIV and AIDS Awareness Day. And then also, this whole month is STD Awareness Month. So we thought we'd do something a little special. And we're actually so excited to announce that we have a partnership with UC San Diego Health, which we're literally just so happy about.
I mean, freaking cool.
Yeah, it's so, we're yeah, we partner with UCSD Health. How cool is that? I'm obsessed.
Ash.
But I mean, I think there's we're going to be talking about sexual health. We're going to be talking about getting tested for STIs. And it's just such an important conversation. And I feel like something that we don't realize, but as zillennials, we kind of see how Gen Z handles talking about sexual health and how millennials, especially older millennials, and then even older generations talk about sexual health. I mean, how have you seen kind of that manifest?
I think over the years, especially in college, right, when you get into that, when people start dating and hooking up or whatever, you really see how open people are about talking about it. And I think when I first got to state, I was kind of shocked of how open people were, but it's nice and it's refreshing because it's you learn through people's experiences and you just learn. I don't know, I think people are just so much more open about sexual health and just sex in general. And I think it's refreshing because it shouldn't be something that we're scared to talk about. I mean, obviously when it comes to certain things, some people are going to be more quiet or not going to say as much, but I think just in general about testing and about just some of their experiences, I think it's so important. I have some girlfriends who talk to me about their experiences and I'm like, thank you for sharing, because it's the more you know, the more it helps you make informed decisions. And then also just I don't know, I think it can be kind of awkward sometimes to talk about getting tested or about certain stuff having to do with sexual health. So just having someone or a couple people that are open about it, it just helps not make it as awkward and helps make it easier for you to maybe go get tested because it's not this big scary thing. It's not taboo.
Yeah, and I was even thinking about just growing up and kind of in middle school, having those sex ed classes and which, first of all, my sex ed was not good growing up. That's something I
Mine
personally,
either.
yeah, I hope to revamp in my future. Would love to do that as a career. But I just think it's, you look at in middle school, they would show the worst kind of cases and the most severe cases of different STIs to scare people and to make it seem like this really scary thing, don't catch it, abstinence is best. But it's the fact is people are having sex and people need to be safe, and it's doing no justice to not discuss these kind of topics. And I think that's what's so important, and that's what I love about this episode that we're doing today, is it's so important to talk about it. And I also think it's so cool because back then when we were in middle school, elementary school, high school, even, it was kind of older generations that were controlling the narrative and controlling what we see in media. Whereas now with TikTok, with social media, we're able to learn from each other and kind of learn it's cool to talk about these things. It's good. We're raising awareness and we're being open about our experiences. I mean, you see it with mental health too. You see it with all these other conversations. And I absolutely love that. And I love that about our generation.
I love that about our generation too, and, you brought up such a good point about health, or, I mean, mine wasn't even called sex ed, it was called health, and I went to a for context, I went to a private Catholic school in the San Fernando Valley, so, I mean, obviously, there's a reason they didn't call it sex ed and they called it health, but it was just, they literally, made you so scared to ever have sex, to ever go get tested, and I think that's what a lot of people do, they just make it so scary, but I think it's just, so important that, people are really breaking down these walls now, like you said, with TikTok or just talking with friends and just being more open about their experiences or their experiences getting tested and stuff. And it's just because it's everyone needs to do it because you really are doing it for one, yourself, your partner, and your community. Because if you're like, if you have multiple sexual partners, you could be potentially, exposing a lot of people to it. So it's important that you know and you get tested.
And with all that being said, today we're joined by Dr. Susan Little and Akeela Benson from UC San Diego Health. So thank you both so much for joining us. As we were saying, we're so excited for you both to be here. So I kind of wanted to get first into each of your roles at UCSD Health and how you got your start in this field.
Akeela, take it away.
Well, I'm super excited to be here as well. Thank you so much for having me. I work at UC San Diego Health with the Antiviral Research Center, and I got started in this field due to the COVID-19 pandemic. So I'm super excited that it provided the opportunity for me to get into research. I've actually been in urgent care for 7 years. So this is super exciting that I'm here. And I love working alongside Dr. Little, who you'll hear from next.
And I am an infectious diseases physician, and I work at UC San Diego, and I've been here forever. I came to San Diego and did my infectious diseases fellowship in 1990. And I've been interested in infectious diseases all my life. I'm one of those apples that didn't fall far from the tree. My dad's an infectious diseases physician. And I got interested in HIV during my training and honestly just wanted to understand better how HIV worked and caused such a range of problems for people who were living with HIV and wanted to better understand how I could help people living with HIV.
Wow, that's super interesting for both of you guys. So, what exactly is sexual health?
So, sexual health is the physical, emotional, and mental and social well being a person has in relation to their sexuality and sexual relationships. What I do want to emphasize, it does not necessarily mean the absence of disease or dysfunction, which is an important distinction to make when discussing the importance of STD and HIV testing.
Awesome. And so, sexual health, we know what it is. How can someone incorporate sexual health into their routine?
Well, I think I'm going to take this one. I think probably the easiest part of it is to make sexual health testing for infectious diseases a regular part of your routine, just like brushing your teeth. I think most people are aware that they should be aware that need to get tested for their sexually transmitted diseases if they have symptoms. But I think what many people are not aware of is that even in the absence of symptoms, they should make it a part of their regular health routine to get regularly tested when they don't have symptoms. And so I think that's what we consider part of routine sexual health. And I think it's very important to find a place where you feel comfortable, where you feel respected, and your sexual relationships are respected so that you can get regular sexual health and get tested on a regular basis.
Yeah, I definitely agree with you. I feel like a lot of people don't think about getting tested until something happens or until they feel like they have the symptoms. So, speaking of that, let's talk about getting tested for STIs and HIV. What does that process look like?
It can look actually quite different for different people. So I know this sounds kind of odd. The most common sexually transmitted infections in the United States are gonorrhea, chlamydia, and syphilis. And HIV is a sexually transmitted disease, so I'm always going to throw HIV in there, even though it's not in the top three. But depending on what your sexual relationships are like, the kind of testing that you receive when you go in for sexually transmitted infection testing may be different. So if you're a man who has sex with men, or a woman who has sex with women, or a man who has sex with men and women, etc., the type of testing you get may be different, and that's appropriate. But the most common types of testing are testing for gonorrhea, chlamydia, and syphilis, and maybe HIV. And that's generally going to involve swabbing at mouth, rectum, and vagina, and blood tests for syphilis and HIV, and a urine test. And so those are the kinds of tests that are run. And oftentimes those tests can be run rapidly. Increasingly, there are many kinds of tests that can be run very rapidly. So I'm going to plug our good to go location where many tests can be run very rapidly and turned around in minutes. So many people don't know there's a test for HIV that takes 60 seconds, and we can tell you your HIV test results. Yeah, so I think there are many tests that can be run very rapidly. There are other tests that need to be sent off. But I think, again, learning about your sexual health, a lot of it can be returned very quickly.
That's really good to know, especially because I know a lot of people, myself included, get a lot of medical anxiety. We're like, okay, we have to go get something done, but oh no, I'm scared because I don't know what it's going to be like. So I think that's really good how unintimidating the process really is when you kind of put it in that way. So, what exactly is the landscape of STD testing today, and which communities are being disproportionately impacted?
So the STI epidemic has been compounded by challenges secondary to the COVID-19 pandemic. These include decreased clinic capacity due to clinic closures, reduced hours, and a diverted workforce, and STI drug shortages as well, specifically azithromycin. And that's related to a supply chain distribution and diagnostic molecular test kit shortages. So, what this means is basically we don't have the resources to test everyone that we need to test due to COVID. So here's a fun fact. As of December 2020, 45% of CLIA certified labs reported a shortage of supplies used in the molecular detection of STIs, to include those for chlamydia and gonorrhea. These are the same machines that are used to test for COVID testing. So they've been diverted to this effort. So that leaves a gap, right? To where we're not able to be tested like we're supposed to. And since asymptomatic patients are the ones that are supposed to get the recommended screening and services and appropriate treatment in a timely fashion, since they're not able to be screened like they usually would before this pandemic happened, there's a gap in care. So that is really important to highlight as far as the landscape of STD testing today. And proportionately, this African Americans are among the highest racial group that has health disparities. So, with chlamydia, 5.6 times the rate among those of the white population, 7.7 times more likely to have gonorrhea than those of whites, and then primary and secondary syphilis, 4.7 times. So, that's important to highlight as far as the disproportion and the disparity associated with STIs. Not only are there racial and ethnic minority disproportions and disparities, our youth is affected as well. So nearly 50% of STIs are estimated to occur in those 15 to 24 years of age, which is huge because those 15 to 24 years of age do not make up 50% of our population. So there's a strong disparity there. So we have to address our youth, and it starts with getting tested. Another situation as well is men who have sex with men with STIs. We estimate that 10% of new HIV cases are attributable to chlamydia and gonorrhea. So therefore, co-infected patients need more screening as well. So with this gap, there's a problem. So the COVID pandemic really made it to where STI testing and STI treatment is put to the wayside, and we want to say that that's a no-no.
Yeah. Do you think, because you mentioned how 15 to 24-year-olds have make up 50%, I believe. So like, do you think it's partially because when 15 to like 17-year-olds, they might just be kind of scared or nervous to get tested because they're so young, they might not tell their parents, they're like worried about going to the doctor and their parents finding out, etc. Do you think that might be part of the reason as well?
That is definitely part of the reason. And it's very important that, and this is even backed by the CDC, that we create a welcoming environment for our patients. And that's very important. It has to be a judgment-free zone, and it has to be very welcoming so that our patients are comfortable in speaking with us to get the care and the treatment that they need.
Yeah, okay. And in the medical field, have you seen that the younger generation have less stigma surrounding STIs and getting tested? And how does Gen Z talk about sexual health versus other generations?
So I do see that, and I actually had the pleasure of interviewing a Gen Z representative born in 1998, and she chooses to be undisclosed. But the way she speaks of it, and specifically, she said in a nonchalant fashion, just prior to sexual engagement, the conversation would go something like this: Have you gotten tested recently? And is there anything I should be worried about? And that was very calming to hear because with Gen Z, it's become a lot more like comfortable to discuss with your partner prior to engagement than it was back in the 80s or 90s or like early 2000s. So it's 2021, a lot has changed. She also told me that if alcohol or other substances are involved, you are more likely to forget to ask this casual question and therefore more likely to engage in risky behaviors. I thought this was very interesting as well because we have to keep that in mind as the Gen Z population has to keep that in mind. I'm often in denial, but I relate to this population very well. So we have to keep that in mind before we have our situations that could be risky. Like, okay, if I had a few drinks, what does that conversation look like after that? So that's the biggest thing. And then as far as being tested, it was awesome to see that the CDC actually says that judgment-free zone is just as important as what the Gen Z representative told me. And she didn't research it on CDC's website. So I thought that was very great, like that they literally were parallel with the same exact terminology, which is judgment-free and welcoming. And then also it's important too with that population that we as in providers address co-occurring conditions such as like depression and like mental health and substance abuse and alcoholism because that helps because even if we can't directly address those issues like within our actual clinic, we can provide that linkage to be able to close that gap so that they're more comfortable about discussing STIs because for example, if if I have inadequate housing or even domestic abuse, if I'm being abused by like my partner and I'm scared to like go get help about it, I'm probably not going to be too worried about transmitting chlamydia. So we have to address other issues as well.
Definitely. And you touched on kind of the shortages because of COVID and testing, but have you seen the decline of people actually getting tested for STI since COVID began?
We have seen a
Yes,
decline.
yeah. There's been a dramatic drop off, and I think not surprisingly, with lockdowns and everything else, people have done what they're supposed to do and stayed in. So, San Diego reflects the national trends, which showed about a 50% decline between even in April of 2020 and those are some of the more recent statistics, 50% decline in most of the STD reporting as compared to January 2020. So I think, as restrictions loosen up, some of the numbers start to go back up. But I think people were reluctant to go out and get tested. And as Akeela mentioned, there were also shortages of resources, machines and cartridges and et cetera, even some of the treatments needed. So, for a variety of different reasons, numbers went down, and people were sort of not accessing sort of the screening that they needed, and we saw declines in numbers. And so, our hope certainly is that as restrictions lighten, this would be a really great opportunity to start making a sexual health plan just like a New Year's resolution. So, Sexual Health Month, go out and make a new plan for how you're going to take care of yourself going forward.
And so kind of like from what after talking to both of you, kind of what I'm getting is like basically, like, whenever you go in for your checkup every year or your physical, just, like, put it into that plan to, like, "I'm gonna get tested for STIs and get tested for everything," just to kind of, like, make it a routine because it shouldn't be an awkward thing, it shouldn't be very uncomfortable, like, obviously, some people, it might be a little bit harder to break that wall, but it really needs to become a habit because when you're helping yourself, you're helping your community. Because what if you didn't know you had something and therefore you haven't been informing your partners, and so therefore you're potentially putting your community at danger. So would you say just to make it a habit of doing it every time you get a physical at least, so at least once a year, but obviously more if you can?
Absolutely. And you're exactly right. I think annual is a very good idea for most people who are sexually active, and then there are certain groups who the recommendation is much more frequently. So, for instance, yeah, men who have sex with men, every 3 to 6 months. So depending on what risk group, and you should again talk to your doctor or look up the recommendations, but the recommendation even for asymptomatic screening on a regular basis, depending on the frequency of sex and the frequency of unprotected sex that you're having, dictate the frequency of testing.
Perfect.
I just love what you both said about how Gen Z is kind of changing the stigma and changing the conversations. I mean, I even see it when I talk to friends about STIs and everything. I mean, like, no, it's such a judgment-free zone. And I feel like when you see it
Mhm.
growing up in
Yeah,
pop culture with like maybe older millennials, you're like, oh, people were kind of judgy about things when there's no
Yeah.
reason to,
yeah,
because I mean, it's something we all can have the potential to go through, and it's just health. That's all it is. And I love that
yeah,
you both are talking about destigmatizing STIs and testing.
Yeah.
yeah. And I will say one thing that I think is wonderful is how easy and free most young people are about talking about it, and be patient with some of us older folks because honestly, a lot of older providers are not. They're still not comfortable with talking about sexuality. So it is critical that people find a healthcare provider who is comfortable talking about sex because they're comfortable with it, and they need to find somebody, a healthcare provider who is as well. Because a lot of people who were trained, you know, many years ago have still not figured out how to talk about sex.
I think you bring up a great point because I feel like getting tested is also kind of like a therapist. Like sometimes the first therapist you go
Yeah,
to might not be the best one, so you got to keep searching around and finding the one that works best for you. And that's the same with like getting tested. Like just because your first experience might have been a little awkward or a little weird or it didn't go how you wanted it to, that
yeah,
shouldn't shut you out and make you never want to do it again. That should just be like, okay, this wasn't the clinic for me, but let's go to the next one and see. Maybe they're more open because
yeah,
find someone that really clicks with you or that just makes you super comfortable, then you're gonna wanna go every 3 months because 'cause you're like, "I wanna catch up with that nurse, and I wanna get
yeah,
tested." So it's like so yeah, I think you
yeah.
can only keep trying until you find a place for you.
It should be a sex positive, yeah, respectful experience.
Yeah.
Exactly. And I also want to touch on the fact too that if you have a situation with a partner or maybe even not a partner, and then you hear that they may have been exposed to chlamydia or gonorrhea, expedited partner treatment is real. It's a real thing. And so you can definitely go to your doctor and I mean, for lack of better words, like request that or bring it up. Like, hey, I've been with someone and, I kind of heard through the grapevine that they might have chlamydia, like, and I would like to be treated. And those guidelines have changed, which is important to point out as well. As far as like gonorrhea, it's like a 500 milligram injection versus 250. And then if chlamydia hasn't been ruled out, it's not just azithromycin, it's doxycycline twice a day for 7 days. So those few things, because it's been the same for so long, it's kind of nice to know that as youth going into the doctor what to expect, right? Because it's knowing is everything. So knowledge is power. So you take that to your treatment provider and it helps a lot.
For listeners who want to learn more, the Good to Go campaign at UCSD has launched a Facts Over Fear campaign, partnering with local nonprofits around San Diego to sort of, again, just what you've been saying, normalize these discussions around sexual health, prevention, treatment. I'd encourage people to look us up at goodtogosd.com. And again, many of the local nonprofits, LGBT Center, San Isidro Health, et cetera, and try and learn more about sexual health and places that they can find for sexual health testing.
Perfect. Thank you. Thank you for that. So we're going to actually put that information in the description of this video and in the description of the podcast as well. So you guys all have that information ready and handy. And yeah, just start thinking of ways to implement it into your routine. Make it a habit. There's nothing to be scared about because literally knowledge is power and you're literally helping protect your community and the people around you by getting tested. And if you do have gonorrhea or chlamydia, it's not the end of the world. There are ways to get help and ways for you to to treat it. So it's important just to go out there and get tested.
If you are treated for chlamydia, gonorrhea, or trichomonas, the latest guidelines do say to go get tested again in 3 months. So that retest doesn't happen as often as we would prefer. So retest is great. 3 months after treatment.
You got it. You got it. All right. Well, we always like to end our show with a little bit of good news of the week. So why don't we start with Akeela? What is the best thing that's happened to you this week?
So I had family come in, and this is kind of weird, but it was exciting to me. I had family come in recently, and they seen like the moon, right, in the like total daytime. And I'm from the Midwest, so we don't see that often. So when I first moved here 2 years ago, I got excited about it too. So to see my cousin get excited about it was like magic. They were like, "Oh my God, that's the moon. It's total daytime. The sun is behind us." And then it was just to see it full circle was amazing. And it's the little things like that that I get like super excited about. But yeah, witnessing my family see the moon in daylight was gorgeous.
I
I
love
didn't
that.
realize I'm from California my whole life, so I didn't realize that wasn't a thing. Like I didn't realize that some people didn't see that. So this is I learned something new
Yeah, I
today.
had no idea. I love that. I love the little things.
The little things.
Dr. Little, how about you?
Speaking of the little things, these are things you never would have thought you'd think were special. This week, I had my very first lunch with a friend without a mask.
That's awesome! Yay!
So we're finally at that stage where, I'm vaccinated, he's vaccinated. We were able to sit down, not sit 6 feet apart, and have lunch together.
Yes.
So it's like finally
Wow.
starting to happen.
Oh, I
That's
love
amazing.
that. I can't wait to be able to do that too.
Yeah. It was a big moment.
Alex, how about you? What's your good news of the week?
My good news of the week, my boyfriend's actually going on a work trip for 6 weeks, so my cat gets to stay with me here at my house rather than his, so I love it. 6 weeks, it might be a little long, she might annoy me, she's like in the background meowing, but I still love her being here.
That's so fun. And then I guess mine is I got my first COVID vaccine this week, and so did my dad, and my mom's fully vaccinated. So I'm so happy. Like this is the best. My mom has a pre-existing condition, so it's just the fact that everyone in my household is vaccinated now is just like, I mean, not fully vaccinated. My dad and I still have another one to go, but it's just like a weight kind of starting to be lifted off my shoulders, and it's amazing.
It is a huge weight when you get that, get through that.
I like wanted to cry. Like it was like so fast. I didn't even feel her put it into my arm, and then I was like, and I like literally almost started crying. So it's just like I didn't think like this would happen. I really thought we were still a long ways to go, so I just felt so blessed to get the vaccine, but
Yeah.
Yes.
but well, thank you both so much for joining us and for giving us all this amazing information. We really appreciate it.
And of course, as always, you can find us on social, on Instagram, on Twitter, and we will be posting a lot of resources surrounding National Youth HIV and AIDS Awareness Day, so check out that. But you can find us on Instagram at What a Week Show, and you can find us on Twitter and TikTok at What a Week Show _.
And on YouTube, we are What a Week with Alex and Emily, so make sure you subscribe, like, leave comments, and if you want to go the extra mile and be a Patreon for us, you can do that as well. So thank you all so much. Have a good rest of your week, and we'll see you all in a few days for the next episode.
Yes, bye!